Come in.
Doctor.
Yes, I'm a doctor. You are that person from the other time, aren't you? That you came with your grandmother.
Yes, I came here because my grandma has been suffering from strange behavior, and we're worried for her.
Okay, let's accommodate ourselves and tell me what has been happening with your grandmother again.
She has been forgetting things, and it has been worrying me and my mother. She forgot who I was, and I thought I was trying to rob her. Every day we must help her with everyday tasks, and we don't believe this behavior is normal, so we're very worried.
I don't think I have anything. I think you're making a fuss, young man.
Grandma, come on, stop this.
Okay, I see. Well, the symptoms you're suffering are really common to different neurological diseases. So I'm going to ask you a set of questions. It's going to be one or two questions so I can have background information. If you can answer some of these questions, it's going to be perfect. Okay?
Okay.
So, what behavior start?
It started around 4 months ago, when she started to forget things that she usually does by nature.
Okay. Second question: does your family have a history of having any type of neurological disease?
Yes, I think, if I'm not wrong, my great grandpa had Alzheimer's, and it was really sad for my mother because he started to forget everything.
I see.
I don't think it's that bad. I consider that I can still take care of my person.
Well, let's see what uh, what can we do with this, and we will make some tests and studies to see what's happening. Okay, I have the results, and based on the questions and based on the tests and studies that you gave me, I'm sorry to say that your grandmother has Alzheimer's disease.
Doctor, may you tell me how you have come to this conclusion?
Oh, well, as you know, we performed several studies and different tests to know what was happening to you. After some psychiatric evaluation, test of memory, problem solving, counting, and some others, we also made some brain scans, magnetic resonances, and other complicated testing. The results show that your grandma suffers from Alzheimer's disease. This is the conclusion that we came with. Also, as you said, apparently you have a history of in your family.
Is there a cure?
Sadly, there is not really a cure. Most of the existing treatments are to help improve symptoms temporarily. Personally, I would recommend going with a person that's specialized in neurological diseases. But most likely they are going to treat your grandma with some ACHE inhibitors and therapy. Alzheimer's disease affects the brain and the damage can start 10 years before the patient has any type of symptom. So a normal brain looks and a picture of the brain of a person with Alzheimer's. As I see you, you have been better.
Yes, the medicines have helped her with memory, and we're very grateful that we can spend more time with our grandmother.
Remember that this disease can be hard and tedious, but if your grandma is worth it, then continue with the treatment.
Thank you, doctor. You have helped us a lot.
Yes, thank you so much, doctor.
Yes, don't worry. Just take care of your grandma and be sure to follow her progress.
Uh, Hello, Dr. Diana. How have you been?
I've been good. I just had a case with a grandmother with Alzheimer. It was just so it's such a it's just so bad when people have those type of disease.
Oh no, that's really unfortunate.
Hi.
Hi, how are you?
Well, I've been having some trouble walking, and also I have some fatigue and pain.
Uh, How long have these symptoms been there?
I recall since 6 months, more or less, especially when I was trying to get down the stairs.
Oh, so how old are you?
I just turned 29 the last Saturday.
Have you had a depression or any spasms lately?
Well, yes, due to the pandemic, I've been working at home lately. I haven't gone out in some days now, and so yeah, I don't feel as happy as before. And well, yes, I also have some experiencing some numbness in my right leg, as long as some muscle spasms.
Okay, so I'm going to order an MRI, a blood test, a spinal fluid test, and a physical examination. These tests will help me determine which disease you have or which problem you have. After the test, we have come to a diagnosis. You have multiple sclerosis. It is an autoimmune disease in which the immune system attacks the myelin that covers the nerve fibers, causes communication problems between your brain and the rest of your body, causing some symptoms like vision problems, numbness, muscle spasms, and some changes in mental health, which are some of your symptoms.
Oh my, that sounds bad. But um, I've heard of this disease before. I think my coworker had it some years ago. But his case ended up pretty badly. I think he ended up in total paralysis. Is there any cure?
Uh, the good news is that it can be treated but not cured. We could reduce your symptoms to at least make them better by treating it with doses of corticosteroids, which are used to reduce the nerve inflammation, and also interferon beta medications to reduce the severity of the relapses.
Well, thank you. This at least will certainly make my life easier.
I also strongly recommend going out more and doing physical activity more often, as well as maintaining a good diet.
I will. Thank you.